Okay, what we've been seeing is that the lifestyle changes, increasing in the numbers of smokers and alcohol consumption, and there are lots of people who are, the number of infertile people is actually increasing. You must be coming across lots of patients who have a zero semen count, and I've seen that many of the doctors claim to actually treat that. Is that treatable through medicines?
Not actually the male infertility. Male infertility is one factor which cannot be treated by any medicines. Like there are so many companies which just prescribe anti-stress these factors or antioxidants, but that is all empirical. We don't know how much it affects because I have not seen the count and the motility drastically improving.
Okay. So if basically what we can say is if the cause is the male infertility.
Again, the cause is very difficult to define. What is resulting into male infertility? See, alcohol to a certain extent is okay. It doesn't affect. But smoking, yes, it definitely affects the count and the motility. Now, beside that, there are certain environmental factors we don't know what is reducing the count, and maybe because of the pollution or maybe because what we are eating these days, how natural or fresh foods and vegetables we are getting. So it's a big question mark on part of the male infertility.
So once it is established that the cause of infertility is because of the male partner, then what are the options available to that
option,
couple?
it depends upon to what extent the count and the motility is reduced. If it's mildly reduced, then we can try intrauterine insemination. But if it's moderately reduced, then the patient is advised to go for ICSI, that is intracytoplasmic sperm injection.
Okay. And when does the sperm donation thing comes in?
Sperm donation thing is when the count is very low, count and motility is very low, and the patient cannot afford to go for ICSI. Then they go for donor sample insemination, or if the patient is azoospermic, means no sperm is seen, and even with the testicular biopsy, the sperm is not retrieved, then they are advised to go for, then they don't have any other option.
So basically your advice to such couples would be, instead of wasting money and running here and there, they should come to a tertiary care center like this so that they get the exact answer to their problem.
Yeah, that is true, because we have seen patients will be running from one center to another for many years, and during that time they forget that the wife age is increasing. So that affects the fertility, because if they come after 4-5 years and by the time the women age is more than 35 years, then the chances of IVF or the ICSI reduces to less than 40%. It hardly is than 35 to 38%.